As parents are out checking things off their child's back to school list, local health officials are urging you to add one more: get the kids vaccinated. This comes as a recent CDC report finds more and more parents are opting their children out of it. Joel Vasquez joining us live from the Richmond and Henrico health districts with the latest.
Yeah, Kurt, health officials nationwide and across the state are seeing an increasing trend of parents getting vaccine exemptions for their kids. Now, this could be for medical or personal reasons, but the health professional I spoke with tells me that less kids vaccinated can put more at risk in the classroom. Class is back in session, and while kids are reuniting with friends and recapping their summers, germs, bacteria, and viruses are lurking, looking to spread.
As children start to go back to school, we do sometimes see an increase in a variety of different respiratory diseases, again, as kids who have been apart over the summer are coming back together.
That's why Dr. Elaine Perry, the director of Richmond and Henrico health districts, says it's important that parents get their kids vaccinated before heading back to the classroom.
Vaccines are a very well-proven, very safe and effective method of preventing a variety of diseases, some of which can be very serious and some of which can lead to death rarely. And so it is so important to take time before your kids are going back to school. Go ahead, check their vaccination records, make sure that they're up to date.
However, a recent report from the CDC finds that nearly 3.5% of parents nationwide opted for non-medical vaccine exemptions last school year. That is slightly up from the 2023-2024 school year and up more than 1% from the 2020-2021 school year. While it may seem small, those percentages account for thousands of children.
Children that are not vaccinated and are in schools are at greater risk themselves of becoming infected with those diseases, which is concerning. But what is also concerning is that by them being unvaccinated themselves, there's a greater chance that it will spread.
Dr. Perry says that across the state of Virginia, exemptions went up a little bit, but in Richmond and Henrico, they stayed about the same at no more than 2%. Virginia requires certain vaccines before a child can go to school or daycare. And VDH even has a schedule that shows parents when they should get their child vaccinated. Now, I've put a list of helpful resources, including no-cost vaccine providers, on our website. For now in Richmond, Joel Vasquez, 12 on your side.
Thanks, Joel. Students